Hey everybody, it's Ed O'Keefe, and welcome to another episode of America's Leading Dentist. I'm here with Dr. Bandon Hedgecock to discuss the miracle of dental implants. If you're someone out there who's frustrated with your dentures, missing teeth, maybe you have a partial, maybe you have failing teeth, and you're just wondering, are dental implants right for me? We're going to answer all those questions today. Brandon, welcome to the show.
Thanks for having me.
Oh my gosh, so great to have you or to be here in your office. And I've had a chance to meet your team today.
Yep.
Great people. You do it right.
Thank you.
Let's talk about dental implants. So what was crazy is that years ago, I remember talking to my parents. They both were kind of older generation, so they had partials, full mouth dentures. And I had just kind of coincidentally asked them, like, what do you not like about them? And they went on for like 15 minutes.
Yeah.
And so what do you see when people are coming to you? What frustrations or problems are they experiencing?
You know, I think we see two types of patients. We see the patients who have already lost all their teeth and they're wearing dentures and they hate them. I've not met a single patient who likes their dentures. They wear them sometimes, not all the times. They are hard to eat with. They're hard to chew with. They rub, they cause blisters and ulcers and things like that. The lower one especially, patients are finding that every time they talk, every time they eat, every time they swallow, that denture's lifting up and popping out, and it's just a nightmare for them. So those patients have already lost all their teeth, they're wearing dentures and they hate them. And then we have the patients that come in and they still have their teeth, but they know that their teeth are in bad shape and they're headed for dentures, and they've heard about them and they don't want them, and that might be why they've avoided coming to the dentist for so long, is because they've heard about how terrible dentures are, and they don't want them. And so those are the patients that we're really helping with implants, are those patients that hate the dentures and want to do something that isn't removable, that's locked in place. Or the patients that know they need something and they want a beautiful smile, but they just don't want dentures.
Yeah. Well, do you mind talking to, I think one of the misconceptions of going with dentures is that as an option when there's other options like fixed place implants, is that there's more damage happening by not having something in the bone. Do you mind sharing like what actually happens that causes more problems down the road for people that they're not aware of?
Yeah, and this is especially important in the younger generation or the younger population, the patients who are in their 40s and 50s or even early 60s, and they still have a lot of life to live, and especially now with life expectancies getting longer and longer, our jawbone has one job to do, and it's to support the teeth that are in there. And so when you lose teeth, whether it's one tooth or all your teeth, what you see is that the jawbone starts to resorb, and so it shrinks.
It gets smaller,
It gets smaller, so it shrinks over time. And it's a slow process. It doesn't happen overnight, but you'll see patients who will be in their 40s and their 50s, they'll get all their teeth removed, they get dentures, and then 3, 4, 5 years later, they're back, and they're like, my denture doesn't fit anymore. And it's loose. And so what happens is the jawbone is shrinking, it's resorbing, but the dentures stay the same size. So then you have to make a new set of dentures, or you have to reline the dentures or things like that. And when you put implants into the jawbone to replace teeth or to stabilize dentures, all of a sudden the jawbone is kind of tricked, and it's like, oh, now I got something in there that I've got to support, and so the jawbone sticks around. So having implants actually slows down or prevents the resorption of the bone over time.
Which the benefit of that is like you don't get that older than you are aging look. Like the shrinking, you look older, and you're like, wow, and because you can't do anything at that point.
Well, yeah, because the bone and the teeth, they're all supporting our facial anatomy. And so that bone shrinks, and then our cheeks start looking like they're sunk in, and we get that old kind of the wrinkles and things like that as well.
Now, from the health perspective, let's just talk about absorption of food, nutrients, and stuff like that, because again, the data is clear on if you have implants over dentures. I'll let you finish the thoughts there on that.
I mean, we talk about how unhealthy and overweight America is becoming. And when you're not able to eat the proper nutrition, it only adds to that. And a huge problem we see specifically is in the diabetic population. Diabetes is a huge problem. There's huge correlations between our oral health and our dental health, our gum health, and diabetes.
Wow.
And then, of course, there's the correlation between carbohydrates and diabetes as well. And when you're not able to really bite and eat and chew harder things and more chewy things like vegetables, carrots, broccoli, what have you, nuts that have good protein in them, meats, you know, you're not able to eat and chew those things. You eat and chew the things that you can. And so those are the patients that are just, without even really realizing it sometimes, they're just opting for the softer, easier to eat foods, which are almost always starchy carbohydrate type things, which is terrible for the diets, terrible for our nutrition, and then just kind of puts you in that loop of my diabetes is getting worse and things like this. It's really kind of amazing, an amazing thing, and just a terrible loop to be stuck in for those patients. I had a patient just recently, actually. This was a sidebar, but she was diabetes out of control, terrible teeth, and not able to eat, pain, not able to chew, eating a lot of those types of foods. Already had been diagnosed with type 2 diabetes, and her blood sugars are just off the charts. Like they're not, she's taking medicine, she's taking insulin, all those things. And we pulled all of her teeth and we put in dental implants. And the great thing about removing teeth when they're really decayed and infected and all that is that you're getting that infection out of the body.
Wow.
And she came back 1 week after her surgery, and she pulls out her app on her phone which shows her blood sugars, and you can see before surgery, out of control, out of control, out of control, in the red, in the red, in the red. The day after surgery, in the green, her blood sugar.
You're kidding me.
No, just from getting all that infection out of the mouth, and putting the implants in, even though she had just had surgery, her blood sugars quickly adopted. And so we know that cleaning up the mouth has an impact on our health, and specifically for those types of patients. Yeah,
that's amazing. I mean, it's crazy. It's amazing. So implants. The implants is I want you to talk a little bit about like what you're seeing on the front lines, because there's implant centers now that are spending tons of money flooding the market. I think patients are more confused than ever on types of implants. Maybe they've gone somewhere and it's like they do a one size fits all, like it's $36,000 or nothing package, and I think that's just very misleading to help if you're trying to help people. So do you mind speaking a little bit and like kind of go down the different options of what people can think through? Yeah, so one of the things we pride ourselves on here is trying to customize and personalize our treatment options to what the patient needs and what the patient can afford. And I think we do a lot of second opinions where they're going to these implant centers and they're kind of told this is your only option. And this is what it costs, and they're just worried because financially either they can't afford it or they're not ready for it, or and in a lot of cases we're able to either start with some other options and eventually work up to that option, or maybe start with one arch and work up to both arches. And so we go all the way from single teeth. If you're missing just a single tooth and you need a single tooth implant, no problem, we can do that, replace teeth. And when we get into the full mouth rehabilitation, there's multiple options, and we can do a couple of implants with a denture that's kind of snapping on to those implants. So a snap-on denture, if you will. It sticks in and it helps you chew better and maintains that denture and maintains the jawbone. And that's a lot more affordable than a full mouth of implants with everything screwed in. And for a lot of patients, maybe that's a starting point. And a couple of years later, we can add a couple of implants. Based on possibly budget, based on budget, based on timing, based on life circumstances. Yeah. That's good to know. And so I don't want people to feel like they have to get it, the full fixed thing right away. And for some patients, that might not even be the best option for them. If you've lost a lot of bone already, it might actually, from an aesthetic standpoint, be good to have a little more bulk with a denture. And that's not super common, but we do see it. But we're not trying to just force people into this, hey, you got to get 4 uppers, 2 lowers, 4 lowers, like maybe people have been experienced before. Got it. Exactly. So you can get
2 implants on top, 2 implants on bottom, 4 implants on top, 2 implants on bottom,
Yeah.
6. We go all the way up to 8 implants.
Yeah.
If the jaw is big enough, depending on how many teeth we're replacing.
Yeah.
And then there's removable options. There's options with titanium bars to kind of stabilize things. And then of course there's the full mouth, everything screwed in, porcelain, beautiful, and the full out option.
Yeah.
So I tell patients all the time, it's like, we know that we need kind of a new car, but we might get a new Honda, we might get a new Lexus, we might get a new Mercedes. We can, we're going to get something, but we can get something that fits our life right now.
Yeah, and I think what's super important about that is that the patients realize they're in control of the decision making, and then they can be a part of that process. Which always leads to the next question, right? Which is like, okay, well, implants expensive, like those are the kind of while it is an investment, we've kind of already laid out why it's important. What are the options on helping people be able to cash flow with their monthly installments or payments or financing?
Yeah, so the beautiful thing this day and age is we've got all kinds of third-party financing options available, in-house financing options available where you really do break it up into monthly payments, and you can kind of do it that way. Or we segment treatment. Like I said, maybe we start with the top jaw.
Yep.
Do that on monthly payments. I've had patients do this where, they do that for 2 years, they pay it off, and then they're like, okay, now I'm ready for the bottom jaw, and maybe the top jaw is worse, so we need to start there and then go to the bottom. But the ability to put it on payments over even up to 5 years, and it is like a car payment, and we see this all the time. And I think the cool thing about implants and our mouth and our health and that investment that we're making is so many people go get a car and then they have car payments, and then they pay off the car. And right about the time they pay off the car, they're like, you know what, I want a new car.
Yeah.
And then they go get another car. And in most cases, barring any major trauma or anything like that, these implants are probably going to be there for the rest of your life. Like, these implants are super long lasting and successful.
Well, what's interesting about the car analogy on that is two things. One is the moment you drive off the parking lot, the car devalues by 80%.
Yeah.
And then number 2 is the investment in your teeth that are just such a center point of getting the rest of your body and your health working actually only increases in value over time. Yeah,
and I can't tell you the impact that investment makes in terms of not just your health, but your overall just attitude, confidence. I see people all the time that it's, I haven't really been searching for that new job because I just can't smile. I'm afraid to go talk. I'm struggling in my sales meetings because I don't eat, or I'm afraid to eat in front of people because I'm afraid that a tooth is going to break out, or it just hurts too bad to eat. And so the psychological impact, I don't know that we can really put a price tag on that or a value on what that means to our patients that do this.
Yeah, I'm allowing myself to be more invisible than I should be. I'm not. Yeah, that's so interesting. Great. So if I'm watching this and I wanted to come in and get a consult, how would I go about doing that? And is there a fee? How does it work?
Yeah. So there's no fee for our consults.
Okay.
So free consultations. You can go to our website, www.hedgecockdental.com. You can call the office. We've got the online website forms that you can click and give us some information. And I'll tell you, my team, we've got an implant coordinator here at the office. She's fantastic. Our team is really good at kind of working with patients and helping them get in and do this. And the first step is to come in for a consult. We're going to review some things at your consult, like your medical history, what types of medications you take. And also we're going to kind of review what your goals are for your health. And we typically are going to do a 3D scan of your jawbone so that we can make sure that there's enough bone to support implants and make sure implants are an option. And then based on what we see, we'll talk to you about what those options are for you and what might work best. And then we can kind of go from there.
Awesome. I forgot to ask you about this. So you were showing me off camera before we got on camera your YOMI.
Oh yeah.
This is really powerful, folks.
Yeah.
This is different. 90% of dental practices, if not more, do not have what we're about to talk about. So
yeah.
Do you mind sharing what the YOMI does and
yeah.
why it's so valuable?
I'm super excited about it because it's been a game changer for our practice, for our implant practice specifically. And I think this is where technology in medicine and technology in dentistry is taking us. We've kind of prided ourselves on being on the leading edge of technology and how to use it with our dental patients, whether it's 3D printing or CAD/CAM milling and these types of things. And this is been really cool for patients. So the YOMI is a robotic system. It's a robotic guided system that helps us place the implants. And if you think about medicine, 30 years ago, before Da Vinci, we were doing surgery for gallbladder removal, prostate removal, appendix removal, and you'd get this big incision, and the doctor would go in and use their hands to cut out everything. And now with the Da Vinci, it's almost archaic if you have your gallbladder removed or your appendix removed without being robotic. The robotic system is really, because it's been shown to have better outcomes. And that's what we see with our robotic system, the YOMI system here with our implant surgeries. But what it does is it allows us to digitally plan our implants in a software using the patient's x-rays and their scans and know exactly where the implant's going to go. In the old days before the robotic system, we're using stone models, we're using our eyeballs, which are good, but vary day to day or patient to patient. And we're dependent upon our skill to angle the implant, and it's not always 100% accurate.
Yeah.
And
is that how most is that how most offices are still doing dental implants?
I'd say, probably like you said, 90% of implants are not being done with a robotic system.
Yeah.
I'd say 50% of implants are being done with some sort of a guide, meaning it's like a plastic retainer that's placed on the teeth that shows you where to put the implant.
But it can't see the nerve.
But it can't really see the nerve, and it can't really. So there are things that have progressed, but this allows us to be more precise, more accurate with our implant placement. We know exactly where the nerve is or where the sinus is, and it will not allow us to go there and go beyond. And so it's just really helped us. And with that, our patients, the surgery time is faster, and so we know surgery time faster, less post-op issues, less pain, less swelling, that kind of stuff. And a lot of times we don't even have to do an incision or a flap. So
is that right?
Yeah, so we can go, instead of having to cut the gums, flap them back, and go into the bone that way, we can go right through the gum, so it's a smaller access hole. So less potential for infection, again, less healing time and all that kind of stuff.
That's incredible.
Yeah.
Yeah. On the cutting edge. Man.
Cutting edge. It's been a game changer, and the outcomes are just, like I said, we've done. We're upwards of probably approaching 1,000 implants on this now.
Are you kidding me?
And in the last 2 years, and just really good outcomes with our patients.
So one of the things we talked about was the investment in that system. It's not an inexpensive system by any means, right? But you made the decision to invest in it anyway. Why is that, from a perspective of this is obviously you're the leader of dental practice and.
Well, I think because we want what's best for our patients.
Got it.
We want to do what's best for patients, and we want to make sure that we're getting, and especially when we talk about implant patients, this is it's a big procedure. It's a time commitment. It's life-changing for our patients, and we want to make sure that we're having the best outcomes possible. And so when I think about anything that we're doing in the practice, I think about my mom, I think about my dad, I think about my grandma. And I'm thinking, okay, if this was my family, how would I want this done? And what kind of treatment, what kind of materials, what type of procedure would I be doing? And so whatever that is, that's what I want for all my patients.
Amen.
Yeah,
I love it. It's like, well, we're asking people to make an investment in their health, and we're leading by making an investment and giving them the best of the best for everything we're doing. That awesome. So hey, if you're out there, whether it's you can relate to whether my teeth are failing, I'm missing a tooth or many teeth, or you're currently frustrated with your dentures, whether that's partial or full, and you'd like to come in for a free consult, please reach out. You'll see on this video somewhere where you can go to Hedgecock Dental or give the team a call. And no guilt, no shame, no judgment. They're here to help you. And, it's absolutely free. We'd love to see you here. So thank you so much, Dr. Bandon, for doing this.
Absolutely. Thank you.
It's been awesome having you on the show. And so that's it, everybody. We'll see you on the next episode. Thanks so much.